Welcome to the Fracture Prevention Central webinar, NOF NBHA QCDR, Maximize Reimbursement and Results for Your FLS and Osteoporosis Efforts. Fracture Prevention Central, brought to you by the National Bone Health Alliance, is made possible through support from Amgen Inc. and Eli Lilly and Company Inc. I'll now introduce you to Zebby Zeldow, Senior Director, Clinical Programs for the National Bone Health Alliance.
Thank you all for joining us today for our Fracture Prevention Central webinar on the NOF NBHA Qualified Clinical Data Registry. As many of you know, the National Bone Health Alliance was launched in late 2010 as a public-private partnership that brings together the expertise and resources of its public, private, and nonprofit sector partners. NBHA provides a platform for all of our partners to address the issues that are most important to bone health. We currently have 55 organizational participants that include 35 nonprofit members, 16 private sector members, and 4 government agency liaisons, which provides a collective reach of over 100,000 healthcare professionals and 10 million consumers. NBHA's vision is to improve the overall health and quality of life of all Americans by enhancing their bone health with a focus on addressing the priorities of the Bone Health Summit National Action Plan, which are to promote bone health and prevent disease, improve diagnosis and treatment, and enhance research, surveillance, and evaluation. Fracture Prevention Central was launched in March 2013 to help healthcare professionals and administrators implement a coordinator-based post-fracture FLS model of care to reduce secondary fractures and the associated costs while increasing patient outcomes. There are currently over 2,300 registrants to the site. As many of you probably have seen, Fracture Prevention Central hosts materials from a number of successful domestic and international post-fracture care programs that you can use and adopt for your work. In addition, the site highlights the work of leading FLS programs, including the American Orthopedic Association on the Bone Program, Kaiser Permanente, and Geisinger Health System. Now I'd like to introduce our speaker, Jessica Safko, Manager, Provider Products, CE City. Ms. Safko currently serves in the role of Manager of Provider Products. In this role, she manages the product lifecycle for the company's quality reporting solutions, including the Physician Quality Reporting System. Jessica?
Thank you, Debbie. Hello, everyone, and thank you for joining us this afternoon. On the slide shown here, we see the many pressures affecting providers at this time and the need for one solution to align quality reporting for measurement, report submission, performance improvement, and certification. Today, we will overview the current financial risk around 2014 PQRS reporting, as well as the NOF NBHA Quality Improvement Registry, and why it stands apart from other registries as a qualified clinical data registry which aids in satisfying these current needs. The NOF NBHA Quality Improvement Registry can assist eligible providers in avoiding the maximum penalty and achieving the maximum incentive under the PQRS and value-based modifier programs. These programs collectively place approximately 2.5% to 6.5% of eligible providers' Medicare payments at risk. PQRS carries an automatic 2% penalty for non-participation and a 0.5% bonus for those who successfully report PQRS measures. 2014 is actually the last year where there are incentives available for PQRS reporting. The value-based modifier applies to providers who are part of a tax ID with 10 or more providers and carries an automatic additive 2% penalty for non-participation in the PQRS program. The value-based modifier also carries up to a 2% incentive for practices of 10 to 99 providers based on a cost-quality ratio. And for practices of 100 or more, there is a -2% to +2% payment adjustment, a penalty or bonus, based on a cost-quality ratio. Reviewing the incentives and penalties with different sized practices shows that the reimbursement at risk grows with practice size in 2014. Groups of 1 to 9 are only affected by PQRS penalties and incentives in 2014, although it is still very important to monitor measure scores to prepare for the future. Groups of 10 to 99 are eligible for both the PQRS and value-based modifier incentives. Non-participation in 2014 will only result in a PQRS penalty, which is again 2%. For groups of 100 or more providers, all incentives and penalties are applicable as you see on the slide shown here. Groups of this size are automatically enrolled in the value-based modifier program. In the coming slides, we will review how the NOF NBHA Quality Improvement Registry can assist you in continuously monitoring your performance scores to maximize your value-based modifier quality score and incentive payment. Looking at the proposed penalties and incentives for PQRS and the value-based modifier, we see that a group of 1 to 9 providers are proposed to have the opportunity for up to a 4% bonus in the future, or a 2% penalty for non-participation, resulting in a proposed total of 6% of their Medicare reimbursements at risk. Groups of 10 and more are proposed to have a negative to additional 4% bonus or penalty through the value-based modifier, and also an additional 2% penalty for non-participation in the PQRS program, resulting in a proposed total of 10% for their Medicare reimbursements at risk. The NOF NBHA Quality Improvement Registry is classified as a Qualified Clinical Data Registry, which is new in 2014. The QCDR method provides a new standard to satisfy PQRS requirements based on satisfactory participation. This type of registry collects medical or clinical data for the purpose of patient and disease tracking to foster improvement in the quality of care furnished to patients. The data submitted to CMS via a QCDR covers quality measures which are not limited to PQRS measures across multiple payers and is not limited to Medicare beneficiaries. Reporting through a QCDR entails reporting at least 9 measures across at least 3 national quality strategy domains, with the inclusion of at least 1 outcome measure. As I mentioned, a QCDR is not limited to PQRS measures and may include up to 20 non-PQRS measures. The NOF NBHA Quality Improvement Registry aligns multiple professional and value-based incentives through one integrated data pipeline and registry, enabling performance improvement, professionalism, and value-based payment. These facets coming together fosters patient and professional education through tools and resources for improvement. Let's move forward to review a case study of orthopedic surgeons within the PQRS and value-based modifier programs. Using the example of a group of 110 orthopedic surgeons, we see that with the average Medicare payment being $104,123 a year, the total at-risk dollar amount surmounts to $744,477.19, with the average per provider risk being $6,667.97 for non-participation. The actual 2014 incentive for successful reporting would be $57,267.48 for a group of this size, and the additional value-based modifier incentive would be $229,069.90 for a high-quality, low-cost score for a practice of this size. Here, we can see in context not only what incentives are to be gained through successful reporting, but the total risk for non-participation in 2014. Now we'll move forward and review the NOF NBHA Quality Improvement Registry. The NOF NBHA Quality Improvement Registry is one of 36 total approved QCDRs in 2014, the only QCDR customized for patients with osteoporosis. This QCDR registry allows providers to submit their measure results to CMS to meet their 2014 PQRS requirements through a total of 14 measures, 6 PQRS, and 8 non-PQRS measures. Participating in this QCDR registry will allow eligible professionals to submit their quality data results to CMS to meet their PQRS quality reporting requirements, as well as the ability to satisfy the CMS Meaningful Use Stage 2 Menu Measure 6 for specialized registry reporting, which must be submitted directly from a certified electronic health record technology such as this registry. Eligible professionals can also submit around their maintenance of certification requirements, which requires proof that an eligible professional has the practice-related knowledge to provide quality care in a particular specialty. The NOF and NBHA Quality Improvement Registry, in collaboration with CE City, is intended for all providers with specialties caring for patients with osteoporosis, and provides participating providers with timely custom continuous performance monitors, performance gap analysis and patient outlier identification, access to improvement interventions to close performance gaps, including patient care management tools, targeted education resources, and other evidence-based interventions, as well as comparison versus registry benchmarks and peer-to-peer comparison. We will now review the measures which are available within the registry. Here, you see the 6 PQRS measures associated with the NOF and NBHA Quality Improvement Registry. Additional details and data collection requirements for these measures are available at the NOF NBHA Quality Improvement Registry website. Here are the 8 non-PQRS measures associated with the NOF and NBHA Quality Improvement Registry. Additional details and data collection requirements for these measures are also available at the NOF NBHA Quality Improvement Registry website. To begin participation with the registry in 2014, first, determine if you are eligible to participate. Eligible professionals are essentially any provider who bills Medicare for covered services. Go to the medconcert.com/FractureQIR web address to access the registry online. We will now review the NOF NBHA Quality Improvement Registry. The NOF NBHA Quality Improvement Registry allows several methods for data entry, including manual data entry through online forms, data upload tools for loading files directly into the product, and custom data integration services from CE City's expert data management and integration team. The NOF and NBHA Quality Improvement Registry provides a longitudinal view of the measure scores for your practice to allow you to continuously measure and monitor quality measure scores. Manage your data around a core set of both PQRS and non-PQRS measures through the NOF NBHA Quality Improvement Registry. Pictured on this screen is the dashboard, which includes each measure being tracked, performance score trend lines, quality measure scores, measure gaps, which are compared to practice and national benchmarks when available, and a drill down to see the providers contributing to each quality measure score. The NOF and NBHA Quality Improvement Registry Analytics equips you with the tools necessary to measure performance and make quality improvements to potentially increase your scores prior to submitting your final measure scores. The NOF NBHA Quality Improvement Registry provides analytics at the provider level. Pictured on the screen is the provider level dashboard, which includes each measure being tracked, performance score trend lines, quality measure scores, measure gaps, which are compared to practice and national benchmarks. Patient outliers are also identified through the registry. Here, you can identify at-risk patients or patients falling outside of the measure numerator and manage quality measure compliance at the patient encounter level. Once a measure gap is identified, the NOF and NBHA Quality Improvement Registry automatically identifies improvement interventions. The green How Do I Improve button is associated with each measure and links to relevant improvement tools, including relevant clinical guidelines and continuing education materials. In addition to the performance management and quality improvement tools, within the registry, you can also receive additional benefits and recognition through participation such as the Physician Quality Reporting System, maintenance of certification, and Meaningful Use Stage 2 Specialized Registry Reporting. You can use your registry data for PQRS reporting. This Qualified Clinical Data Registry qualifies as a CMS-approved reporting tool for PQRS reporting. The custom measure set available through the NOF NBHA Quality Improvement Registry is designed specifically for practitioners providing care with patients with osteoporosis. Again, to qualify for PQRS through a QCDR, you must select at least 9 measures, with the inclusion of at least 1 outcome measure, over at least 3 national quality strategy domains for 50% of your patient population. To finalize submission of your reporting to CMS, an attestation module will also be completed. Successful enrollment and submission of data to the NOF NBHA Quality Improvement Registry for the purpose of satisfying the MU2 MU2 measure number 6 for specialized registry reporting is contingent upon submission of data directly from a certified EHR technology to the registry. Providers who would like to achieve the MU2 menu measure number 6 will need to contact their EHR directly to the NOF and NBHA Quality Improvement Registry. EHRs who are interested in submitting data to the NOF NBHA Quality Improvement Registry should contact CE City directly for more information and for information about how to get started. The NOF and NBHA Quality Improvement Registry offers participating physicians the ability to reuse their registry data in the form of board-ready reports for self-directed PIMs for MOC Part 4, Practice Assessment and Quality Improvement Activities. The ABIM self-directed PIM for Performance Improvement module will grant Part 4 MOC credit to physicians who complete the ABIM self-directed Practice Improvement module. Through the registry, you can reuse the registry data for MOC according to board-specific policies. For more information about MOC through the NOF NBHA Quality Improvement Registry, please visit the MOC tab of the registry. Here, you can see the pricing for the NOF NBHA Quality Improvement Registry for National Osteoporosis Foundation members, National Bone Health Alliance Partner Society members, and also for non-members. Please note that the data submission deadline is February 26th of 2015 for the 2014 reporting period. We will now begin our question and answer session. If you have a question related to today's presentation, please feel free to enter your questions into the question fields now. We have a question about the availability of this presentation for future viewing. You can certainly click the support button on the registry itself and request a copy of today's presentation. Debbie, will this presentation also be available on the Fracture Prevention Central website?
Yeah, you're exactly right, Jessica. The webinar that you are listening to today will be available on demand in a week on the Fracture Prevention Central site. For those who have registered for this webinar, you will receive an email link that will let you know as soon as it is posted.
At this time, there are no additional questions in the queue. If you have a question about today's presentation, about the QCDR registry, please do feel free to enter those questions in the question section of the webcast.
And just to direct that a little bit further, just to make sure our participants are aware, if you'd like to ask a question, just select the chat pod located on the lower left corner of your screen and then type your question and send it in there.
And if you would like us to backtrack to one of the slides that we reviewed today, we could certainly also go to a previously presented slide and talk more to a question that you may have.
Launched like a month ago.
There's a question about the fees for the registry. I'm going to backtrack to the last slide here. The National Osteoporosis Foundation members are priced at $4.99 for registration. National Bone Health Alliance Partner Society members are priced at $5.99, and it is $6.99 for non-NOF NBHA members. The registry is available. You would certainly want to visit the website. I'll go back to some of the previous slides. Here we see the URL for the registry at medconcert.com/fractureqir. The registry is available for access now as well. Again, you would certainly be able to view the presentation again on demand, or click the support link for a copy of the slide presentation from today. Debbie, are there any questions that you would like to address before we sign off today?
Thanks so much, Jessica. Well, I want to thank everyone for joining us today. If you do have other questions that you have not put in today, please feel free to do that right now. Otherwise, I will give you my email address, and feel free to email me with any questions. We'd be happy to respond. My email is Debbie, D-E-B-B-I-E, .Zeldow, Z-E-L-D-O-W, @nbha.org. We really appreciate your time and for joining us today. As Jessica mentioned, the webinar will be available on demand in a week, and we will be sending you an evaluation right after the webinar and would greatly appreciate your feedback. Thank you again, and have a wonderful day.